102.9 DRC-FM. On the phone with me right now, Dr. Joseph Cherneskie, Medical Director of Bristol Hospital's MedHelp Urgent Care Center, and it's time to talk about the flu. Who should get the flu vaccine? Is it everybody? Is it just the elderly and children?
Well, Kim, the easy answer is yes. All adults and children 6 months and older should get vaccinated every year. Certainly there are populations that are more at risk, and those are the groups that we're really going after. Certainly young children, 6 months to 5 years, and everyone over the age of 50 are at particular risk of getting complications from the flu. There's different methods of getting the vaccine. There's the traditional injection. You can get a nasal spray, and there's also vaccines that come with smaller needles that are directed into the skin as opposed to the muscle. And also this year, too, there are options for people who are allergic to eggs who in the past could not receive the vaccine.
Is there a certain kind of vaccine that's better for certain people, or do we just pick which one we feel more comfortable with?
Well, Kim, traditionally, the CDC recommendations do not recommend one over the other. And this includes deciding between the 3-virus and the 4-virus vaccine or the shot versus the spray. But we advise people to talk to their physicians about which may be better for them.
What about for children? A shot in the arm, a nasal spray? What do you think is best?
I know my young boy, 5 years, he has no problem taking the shot, but certainly the nasal is good as well. But it's particularly important that the children get that because children under 6 months, they are the highest risk for getting the flu, but they are unable to get the shot. So it's important to protect these children by making sure members of their household, caregivers, and brothers and sisters are vaccinated to help protect them, spread it to the young child.
There must be someone, though, who maybe shouldn't get the flu vaccine?
Certainly anyone who's had a severe reaction to the influenza vaccine in the past, they cannot get it, and children younger than 6 definitely should not get it as well. But even if you just have a slight cold, we recommend that you still get the shot unless you're having a high fever or are very sick. But the truth is, except for children under 6 months, there are very few people who cannot get the shot.
Can people get the flu from the flu shot, or is that a myth?
Well, the answer is absolutely not. Except for the nasal vaccine, all flu shots contain an inactivated or dead virus that cannot transmit the flu.
So as far as the flu vaccine, there's no excuse?
No.
Okay. Dr. Joseph Cherneskie, Bristol Hospital. For more information, just log on bristolhospital.org.